Welcome, everyone, to another episode of EndoSocial. Thank you for being here. I am joined today by the wonderful Dr. Avril Tynan. I hope that I'm pronouncing your last name correctly, or at least close to correctly. Close
Yep,
enough.
close enough for me. I'm happy with that.
Who is one of the people behind the Endos project, a super interesting project that we will hear much more about today. But as is the EndoSocial tradition, I want to allow Avril to introduce herself. And the question that I always like to ask is for people who don't know you and who don't know about your work, what do you think are the most important or most interesting things that we should know about what you do and about your research interests?
Thank you. Um, and firstly, thank you for the invitation to speak today on behalf of the project. So I've been in literary studies. I was going to give a time span there, but for well over 15 years, I guess. And then for probably the last 10 or so years, interested more in illness narratives, narratives of disease and disability and death. But one of the things that I think is very interesting in my perspective on a lot of the research is that I am critical of what narrative can and cannot do, in particularly in context of illness and disease, and how narratives can and cannot convey lived experience. And my as I joined the Endos project, that's one of the things that I've been particularly interested in thinking about all the time, there that there is an incredible benefit and use to narrative, but there are inevitably some things that narrative cannot do.
And I'm very interested, as I'm sure that everyone is part of the so-called endo community is, when you joined this project, were you already familiar with endometriosis? Is that one of the reasons you joined it, or did you learn more about it as a researcher through the project yourself?
Um, a little bit of both. I do not personally have endometriosis, and so a key part of working on the project has also been working at every stage with people who do have endometriosis. And I met yourself, Alekszandra, and there's several other people here in Austria at your conference a few years ago to to make sure that we were remaining authentic to the wishes and the aims of people with endometriosis. Because I had worked with illness narratives for several years, I was aware of the kind of lack of narratives around, or lack of helpful narratives around endometriosis and some other gynecological disorders. But I certainly learnt an awful lot through this project and through conferences like the one you organised in Graz a few years ago and various other interactions.
Thank you for mentioning the conference. I'm always very glad when we get a little shout out. I put the link, our conference website is still online. So I put the link in the chat if people want to take a look at what it is that we've done. And there, when you look at the program, if you're interested, you can find a lot of really interesting researchers and artists still listed. Okay, I obviously have a lot more questions for you, but I would like to give you the opportunity now to share your presentation with us because I don't want to accidentally ask you something that you're going to answer in the presentation. And I'm very excited to see what you have prepared. So, are you able to share the screen?
I have
Mhm.
just requested that, and now,
It should be through.
yes, that one, which I hope is full screen and visible. Oh, and I can't hear you now.
Oops, sorry. I muted
That's okay.
myself. I wanted to say it looks good to me. If anybody has problem with the visuals, please do put it in the chat. But so far, I think that that it looks good. So Avril, take it away.
Thank you. Um, yes, and thank you again for the invitation to discuss this project and our fantastic work. And it's not just me. There's been a group of us, a large group of us across Europe who've been working on this. But I will discuss today the role of digital and narrative tools in the Endos project and how storytelling in particular can help to promote equitable and humanistic healthcare. And my own academic background, as I briefly mentioned, is in literary studies. And my research primarily engaged with topics of illness, healthcare, disease, and disability. And with the rise, particularly in the Anglophone Academy, but also elsewhere, of medical and health humanities, as well as narrative medicine, I've led or been involved with a number of projects that bring narrative and humanistic methodologies into dialogue with health and illness related questions. And one such project is the Endos Project, a European initiative that is designed to educate and support adults living with chronic diseases, particularly endometriosis. And with this project, we aim to improve understanding of endometriosis and its treatment among both patients and healthcare professionals. We use narrative and artistic tools and artificial intelligence technologies to increase knowledge and understanding of the disease. And one of the core problems that we aim to address, and that many of your listeners here will be aware of, is the critically poor understanding of endometriosis in both medical and public discourses. And one of the most tangible and devastating consequences of this being that as a result of misinformation or just a lack of information, the disease is often misdiagnosed or remains undiagnosed for many years. And the Endos Project aims to change this by amplifying the voices of those affected by endometriosis and developing resources to improve communication between patients and healthcare professionals. And we have used and developed a number of activities and resources designed to help with this. The areas that I will focus on today are those that combine narrative and digital methodologies, although we do have several other resources and training packs that are coming. So when we talk about narrative methodologies, we're really talking about the power of stories, how we tell them, how we hear them, and how they shape the way we understand the world. Narratives aren't just retrospective tools that help us to make sense of what has already happened. They actively influence how we live, how we relate to one another, and how we interpret experiences that might otherwise remain invisible. And endometriosis is a striking example of why narrative matters. It is the most common gynecological disease, and yet paradoxically one of the least spoken about. And this silence is not neutral. From a narrative perspective, it means that endometriosis lacks the very stories that would help people to recognize it, to understand it, or even at times to name their own experiences. And the stories that do circulate often carry connotations of shame, embarrassment, or misunderstanding, narratives that obscure rather than illuminate. And narrative methodologies give us a way to address this. They help us to identify the stories that need to be undone, corrected, or expanded. They allow us to create new narratives that reflect the lived reality of endometriosis, stories that can be shared not only with those who have endometriosis, but also with clinicians, employers, educators, partners, colleagues, friends, families, and so on. And in doing so, we build a collective narrative that fosters understanding and compassion rather than silence or stigma. And so by bringing narrative methodologies into endometriosis healthcare, we're not just analysing stories, We're helping to create the cultural, clinical, and social frameworks that allow people with endometriosis to be seen, heard, and supported. And this is the foundation for meaningful change. But if narrative methodologies help us to recognize the importance of stories in shaping how endometriosis is understood, then digital storytelling gives us a powerful, practical way to create and circulate those stories. And simply put, digital storytelling means using digital tools, video, audio, images, animation, interactive media, and so on, to craft and share personal stories. What makes it so valuable in the context of endometriosis is that it lowers the barriers to telling a story while expanding the possibilities for how that story can be expressed. And when we bring digital storytelling into endometriosis healthcare, we're not just collecting stories, but we're creating a living archive of experiences that can educate clinicians, influence policy, support newly diagnosed individuals, and challenge the cultural silence around the condition. These stories become part of the collective narrative that helps society understand endometriosis not as a private burden, but as a shared concern that deserves recognition, support, and compassion. And digital storytelling, then, is both a method and a movement. It's a way of giving voice to those who have been unheard, and a way of reshaping the narratives that determine how endometriosis is seen, treated, and valued. And so, in the Endos project, we're bringing together narrative methodologies with digital storytelling in the innovative narrative pathway. And this is only one kind of pathway of the project. But this part of the project combines digital storytelling via the DNM Lab platform to collect real stories of lived experiences. And some of this might be slightly familiar to those of you who were at Aleksandra's conference in Graz. But the platform then provides narrative prompts. And these are short, open-ended questions that encourage self-expression and help capture different aspects of life with endometriosis. These prompts were generously co-designed with artists and people with endometriosis, and they encourage personal reflection, creative responses, and a focus on the issues that are important to the individual participant. And the platform was open for several months, and it allowed for stories to be written in English, Italian, or French, the main languages of the project, although we recognise that that limited some contributions. But once the stories were gathered, a small team of narrative medicine experts, including myself and colleagues, analysed the words and images of the stories to compile what we are now very shortly publishing as an emotional dictionary. And this dictionary, which it now has a draft form, but I don't have a physical copy yet. But it's available in all three languages of the project, English, French, and Italian, and it combines personal testimonies with simple explanations of key terms in endometriosis care. The aim of the emotional dictionary is to improve the interaction between endometriosis patients and healthcare professionals. But it's intended for use by anyone who wants to learn more about the disease and promote its understanding and treatment. By reducing linguistic misunderstandings and lexical ambiguities, we also hope to concretely shorten diagnosis times. And I've got just a few examples of the beautiful pages that were designed by our graphic designer here. And in addition to our narrative work, the Endos project has also developed a digital tool designed to support people with endometriosis in navigating their healthcare. Project partners have created an app or a web platform that's accessible on any device that helps users better understand their medical notes and communicate more effectively with their healthcare professionals. This platform, called EndoStand, allows users to upload or scan their medical reports, and the one in the example here is just a generated example. But it translates the often dense and technical biomedical language into clear, accessible language. And it was developed in the three main languages of the project, again, English, French, and Italian, but it functions well across other languages too. And you can see in this example, so the highlighted, the blue underlined words, you can hover over these and they will give you kind of a technical explanation of the term, but also a lay explanation. And then the text as a total is kind of translated into everyday language. And behind the scenes, then, it's drawing on, in these highlighted words, it's drawing on a bank of more than 350 key terms, specifically aimed towards endometriosis, that give detailed definitions and simple lay explanations. But I should emphasize that to kind of conclude, these tools are designed to support understanding and communication. And I've got more links to all of these here, but these aren't diagnostic tools. They do not offer therapeutic recommendations, and anyone seeking medical advice should consult their healthcare practitioner. But what we hope is that these will improve communication and make that healthcare journey, to use a terrible metaphor, but to make that healthcare journey slightly easier and more familiar. And though the project is funded by the European Union, the views I've shared today are my own. And I'll just point to some of these links, but you've got the link to several exhibitions that are connected to the project, as well as at the bottom, EndoStand. The app is live and you can test this out and provide feedback. And thanks to all of the wonderful partners as well. I will stop sharing my screen.
Thank you so much, Avril. Perhaps when you have a minute, if you could maybe copy paste the links into the chat, I think that would be quite useful. But thank you so much. It was a very, very interesting presentation, a very interesting project. I personally find it very interesting because I myself, as you know, research pathographies and so illness narratives, particularly connected to endometriosis. So I'm always excited to talk to somebody who is in literature because there aren't that many of us in this type of research. And I often find, I'm not sure if you do as well, that people get a bit surprised if they hear that you have a sorry, a literary background. They tend to be surprised, well, how do you connect this to health and to healthcare? So in sort of layman terms, to those naysayers or those who wonder how this can be connected, how would you, I mean, you touched upon this in your presentation, but what are some of the, let's call them transferable skills off the top of your head? Like, how did you find that literary studies or studying literature or narratives can be complementary to trying to resolve social issues, but generally let's focus like on a medical one like endometriosis.
Yeah, and that's a great question. And I kind of have a two-part answer. I'll come to why the humanities as the second part of my answer. That's the terrible question that we always have to defend. But my own personal kind of movement into illness studies was relatively easy, and I was originally working with trauma narratives. And so this is not an uncommon trajectory for people in literary studies who went from usually almost homogeneously from trauma studies to memory and dementia studies into the broader diversity of illness narratives. And that's exactly what I did. But there is often some surprise working with literary texts or cultural texts in general, rather than directly in, for example, interview techniques, which is not something I've ever worked with. But I think it's because there is so much value in these powerful, public, and often popular representations of illness and disease. And when those, be it TV shows, be it films, be it novels, when they have a good is not a very helpful word, but when they accurately and authentically portray narratives of illness or disease or disability or death, then they they have staying power in the cultural imagination. And for such a long time, so many diseases and endometriosis is a well, endometriosis was less talked about, but any form of gynecological disorder was so negatively portrayed that it made it very difficult for people to kind of discuss their own experiences because there was no broader shape to how that experience should look or should be talked about. And there are some great works now, some excellent work that's going on to undo that. And in fact, the reason the project title has this hashtag at the beginning is because that's where we saw so much of the grassroots narrative work being done for endometriosis, that it was online on Instagram, later on TikTok, that's where these narratives built from. The kind of, yeah, the power of the cultural narrative to change individual lives.
Yes, exactly. And I would just like to tie this in with some of the previous guests that we had, where Eileen Holovka, who researched endometriosis representation on social media. She published an amazing study about this. And for those of you who were not here, or for those of you watching this later on YouTube, it is one of the previous sessions, so you can look at that recording. And Alicia Pavlutsuk, who works with digital inequalities within the Include project. And I think that just the the fact that this is now attracting research as well is really showing us how people, and once again, as you have yourself said, with illnesses in general, but we're focusing now on endometriosis, that people with endometriosis are really becoming more vocal and claiming space. And we see this in digital spaces so much. And but we also see it in literature, where I would love to refer people who are interested, who like reading memoirs or novels. If you look at Six Stories, the Instagram profile through which I'm assuming that most of you got here, the beginning of that project were interviews that I had done with endometriosis pathography authors. So if you're interested in reading books, which are, they're really beautifully written, they are memoirs, but they're really beautifully written with a lot of just with insights on what it's like to live with endometriosis. You can see a list of authors such as Abby Norman or Emma Bolden, but interestingly, they themselves write in the books about the intense influence of pop culture representations, of social media representations, of blogs. So this is really such an all-encompassing experience. um, and what you now spoke about is basically narrative humanities, right? This emerging discipline. Um, it's not new, but I would say it's more fair to say that it is becoming popularized now. So narrative humanities and medical humanities. What are your hopes, let's say? What would you like to see to be the result of this kind of work? You've mentioned within your answer that unfortunately we always have, which is sadly true, we have to justify the humanities part. Like, why are the humanities people here? Um, so I guess I have a two-part question. What would be your hopes? What would you like to see kind of spill into, let's say, the medical profession of the work that we do? And then I would be very curious to know if you have had an opportunity to present the Endos project within a more or maybe even exclusively medical environment, and what sort of reactions and feedback you got, because I know that it can be quite challenging from social sciences perspective, and especially from the humanities when you enter this clinical space. So I'm really curious if you've had these experiences.
Thank you. And so I guess for both, there is a slight bias in the answer that I can potentially give. Often when narrative or humanities based projects like this are discussed in clinical settings, they're settings in which the clinicians are invited. So those who are interested come, and those who are not interested do not come. So, and I was very surprised years ago when I started kind of researching in the space of medical humanities. I was surprised for reasons I can't really explain, but I was surprised that clinicians were interested, but of course not all of them. And there is also that there are many healthcare workers who are very interested in narrative and humanities methods and artistic methods, but the restrictions of time just make it unrealizable. At an extreme kind of optimistic view, every healthcare interaction would take as long as is needed, and that just isn't realistic. That isn't how it can work. So the my hopes for humanities practices or humanities influences in clinical medicine, I think my personal hope is actually that we have more that we don't think that each side hates each other, because often we don't, but both sides are quite concerned or worried that there's going to be this resistance or this lack of ability to bridge that gap. But we both sides want the same thing, and we can humanities, if we take the approach that humanities could improve the communication side, but not if we don't know what it is we're communicating about or who we should be communicating with. And which leads into the second part of the question. I have presented this, and some of my colleagues have presented this much more in much more intimate settings with clinicians and had very positive feedback. Again, the clinicians that they're presenting to have an interest in this, so there's a slight bias. But we presented this recently at an event here in Finland, and it was about digital diagnostic technologies. There were lots of words that don't come up in my everyday work. And there was a project there that studies that is working on the very biomedical, technical diagnostic side of endometriosis. And we're actually meeting again next week. But they were very interested in our side of the project, and we were very interested in their side. But and we had both kind of been on each other's radar, but been hesitant to follow up on discussions because of the assumption that there would be no shared interest, or that we would be kind of we'd have different target audiences, that our target audiences was more patient associations and their target audience was more the inside the organs. But there is interest there. It's having the right spaces really to share that information, and creating those spaces to share both sides of the projects.
I'm very glad to hear that you had, first of all, the opportunities that you were invited in rooms, or that you created yourself rooms for this, and that you've had positive experiences. I think that's very important and also very motivating for others to hear. And I know that there will be also a lot of young researchers listening to this, so that we kind of encourage them to seek out and to ask. Sometimes the issue really is, like you said, that we are also defensive or expecting the worst, that we don't even ask to create this common space and good things can come out of it. And I believe that you and I both agree on this. I'm a very big proponent of medical humanities. And I really honestly believe that that is the solution, that that is the future, this sort of bridging the gap between the very clinical side of medicine and the human side of medicine in the sense of a personhood of a patient, the lived experience with data. I really honestly believe that this is the only way that we can go forward in everything, for that endometriosis is, unfortunately for the patients, a really good case study and a really good example for, like, an argument for, we see how much damage happens when we are one-sided and when we dismiss narratives actually of patients. Which brings me to I scribbled down what you said about digital storytelling, which I really liked, this phrase that it's both method and movement, which gives it a bit of an activist flair, so to speak. And this is something that I've also dealt with, this question of activism, where, for example, the pathographies, the books that I worked with, there were a lot of discussions about what kind of literature this is, and is it activist literature? And if we call it activism, is it then less academic? And this whole circle of questions. So, what are your thoughts on this? How much of this is activist work? And actually, do you perceive the Endos project as activist in a way, or at least some aspects of it? Because I would say that I actually do, but um, what is your opinion? How do you perceive this yourself?
I think that's a really good question. And there are certainly aspects of the project that are more evidently activist. We have a strand of the project that is based with or is working much more with art and artists. And that collective, and there are several collectives, I'm sure you're familiar with several of them, they would very much position themselves as activists in the field. And we have, on the narrative side and on the tech side, developing the app, we have not explicitly positioned ourselves as activists. And I think we have perhaps more cautiously, and perhaps this is what happens when you're in academia rather than an art background, but we have more cautiously positioned ourselves as raising awareness, which I think about now, and I'm not sure why we are reluctant to use the word activist, but I think we've just been concerned that that we wouldn't qualify in some way under that. So, but raising awareness is certainly at least adjacent to activism, or I would hope it is. Yeah, I don't know. Yeah. How do you think that? And because I think Alicia has spoken here before, and that very much is an activist art movement. But I'm not sure how activism is or should be outside of that practice.
It is a big question. Like, I wasn't expecting you to have, I was just seeking your opinion. I don't think any of us have like an ultimate answer. That's sort of like asking what the purpose of art is, right? It's a
Mm,
very big centuries old discussion. Um, and we had this discussion actually during my dissertation defense, believe it or not. Um, and I stand sort of by my answer back then, that I really think that any academic work and research work that we do, which in the moment is new, is it just must intersect with activism, especially when it comes to feminist topics. Because if you think about it, in my opinion, if you look at feminist scholarship, how it was developing, um, pieces, when I say pieces, I mean books, articles, manifestos that we now teach and treat as a core part of academia. When they came out, they were very much activist. And when we were speaking, or at least perceived as activists, because they were speaking, researching something which was not supposed to be researched, to put it that way. Or menstruation studies, they exist now, but when they came out in the 1970s, that was scandalous. And now we don't teach it anymore as a scandal, right? Because 50 years
Mhm.
later, we are at peace with saying that menstruation happens and that we should research it. And so my hope is kind of that in, I don't know, 20 years, someone will be teaching about the Endos project and that it will be a very interesting project, but kind of understood that we would be doing something like that. Whereas in this moment, we're discussing should we call it activist or not, because it's still so new and it still touches um, something stigmatized. You're still crossing over into a little bit of an area of indecency, as we would say, because everything about female reproductive health tends to be stigmatized. I don't know if you would agree with that view.
Uh, yeah, and I think certainly there is a still a strong level of stigma around it. But I was thinking about another bit of the of your response, and that was that maybe the activism question is wrapped up in a kind of who feels now, and anybody can contribute positively in an activist sense towards kind of raising awareness of endometriosis and preventing the silencing of the disease and the ongoing problems with getting diagnoses. But I feel like, and I think this came up in Austria, that it feels at the minute that we're in a kind of first wave endometriosis studies
Mm-hmm.
scope. And just for some context, for those who weren't there, there was one man, cisgendered man at the event, and it was a predominantly white and young-ish. I'm not sure I consider myself young, but youngish base. And so that there's very much even in what activism if we activism or research that is being done, it has a particular look at the moment. And and perhaps there is some then sort of nervousness perhaps to participate in that activism if you don't fit what currently exists. And so it's that there's always a voice or voices that kind of need to push through that or that need to be openly told they can come into that space. Endometriosis activism can and should be being done by cis men as well.
Mm-hmm.
But I think a lot of them feel that it isn't their space.
Very true. Yes. And this is also something you're definitely right to point this out. It's a very um, homogenous group of people currently. Not to mention that you yourself are a bit of an exception in the sense that you do not yourself have endometriosis. And this is something that I've spoke with some other guests as well, that even the research space is predominantly cisgendered white women who have endometriosis. Um, and that is, yes, something that will hopefully expand. But now that you've mentioned cis men, I would like to we have a lot to go, not a lot, but we have some things to go through in the chat. And there is one comment or comment I would like to address because I know exactly what they're talking about. And those who are chronically online will know as well. And there is a comment from a person referring to a paper which has caused waves on Instagram. I'm going to read it out. It's interesting that there are a few research papers that are focused more on the experiences affected uh, by endometriosis, not the patient or the person themselves. I believe I recently saw a paper on male partners affected by their female partner's diagnosis with endometriosis. The language and research can be crude. And this is a study which has caused waves. I have seen a lot of content online of people taking an issue with the fact that there is so little funding to go around, and then somebody's using this funding to talk about how endometriosis affects men. But I actually would like to defend scandalously so this study a little bit, because I feel that sometimes especially in the online spaces, we tend to also jump on a bandwagon. And I've seen a lot of things being reposted and reposted without it actually being critically examined. And while I do agree that this might not be the best use of funding, I would like to point out the first thing, the author, Lorraine Cully, who everybody who has endometriosis has to thank. She's brilliant, and she has done so much work and so much research that is extremely, extremely relevant for us. I include myself as I myself have endometriosis. I'm a big fan of her research. So the first thing I did was give it a little bit of grace when I saw who the author was, because I knew Lorraine Cully does not mess around. If she decided to research something, it's going to be something good. And the study itself, I think, has this maybe even clickbaity title. Um, what I think it actually does, sometimes we have to go through the back door, right? I think which is very neglected very often. Um, right, we live in capitalist society. Unfortunately, a lot of things are going to be driven by capital, by money, by investment, by productivity. And this study, from the way I see it, one of its goals was to show that not only are the patients affected by it, but society at large as well. And we often see studies talking about the influence on the economy, and also the influence on certain things which we might not, for example, this influence on the male partner. I completely understand why it would rub you the wrong way the first time you see it, because it's a feminist issue and it's very then heteronormative again. There are a lot of flaws in it. But if how do I put this? I will say this very unprofessionally. A lot of the times, men, if like cisgendered men especially, if they do not feel affected by an issue, they will not be interested in it, and they control most of the funding resources. They will then not fund it, they will not pay attention. And unfortunately, the easiest way to get attention to a feminist subject is to not appeal to empathy, but to inform the men why this also really sucks for them. So I find this study as sort of a backdoor way of trying to get even more attention by showing, okay, you care about the nuclear family, you care about the perfect heterosexual woman who is going to be a mother and a productive part of society. Well, look at this. Endometriosis is not only making it very difficult for her to get pregnant, difficult for her to then do her caring duties, but it's also making the life of her male partner really miserable. Shall we get funding now? That was my interpretation. This is my very personal interpretation of this study, and not an attack on anybody. I myself have reposted some of the criticism, so not an attack on anybody who finds this a bit dodgy. I am just giving you second perspective on this. Um, I'm just sorry, I'm just looking at the chat. It's unfortunate. It's unfortunate, but sometimes this would again, we would have to ask Lorraine Cully if this was her logic, but that is sort of how I interpreted it. And we have here, so much endoviolence is fueled by structures of male privilege that extends through relational violence. Yes, this is a very good comment. Endoviolence, the term that we spoke about with Alicia Pavlutuk, and you also have the link here for the website, which features a bit of more detailed explanation. But definitely, it can influence relationships also negatively in the sense of inducing male violence towards their partners. But I digress now into a different topic. And for those of you watching at a later time on YouTube, the links that I keep mentioning that we're dropping in the chat, you can find them now beneath the video in the description. what's the name of the YouTube channel where we can watch the previous talks? Well, it does not have a name yet because I have not posted them yet. Um, we have one more session next Wednesday, and then after that session, all the talks will be posted on YouTube, and I will post the information on the Instagram, and I will also send out an email or through the Eventbrite where you all have registered. Avril, I had now took some of your time just because I really wanted to comment on this question. Um, are there any questions concretely about the Endos project? Oh, and I just remembered the narrative and emotional dictionary. Could you tell us a little bit more about when we could maybe expect it and in which format we could expect to find it? Where could we get our hands on it?
Yes, it is it is in a very final draft stage, and will be available in a PDF, one of those lovely, as a plain PDF, and then as one of those lovely e-zine type things, PDF, in English, French, and Italian. Though if there is, we're open to translating it further than that, but that was the main languages of the project. And we are circulating it widely when it is finalized, and primarily aiming it towards patient associations, but also healthcare centres, healthcare workers, and clinicians who are the ones who will benefit, particularly not from the explanations of the terminology, but from the lived experience extracts that are incorporated into the dictionary.
I was going to ask that, and that is so brilliant that you will try to distribute it along amongst clinicians themselves. And I am very, very impressed actually by the whole concept of the dictionary. I'm very looking forward to seeing it, and I really think that it will make a difference. At this point, I would just like to offer for people who are in the audience if they would like to ask more questions or comment. However, I will be switching off the recording, so turning off the camera now, soonish. So if somebody does not feel comfortable with their comments being read out loud, or they would like to turn on their cameras and say something, but they do not want to be recorded, um, we can have a safe space for that in a second. Avril, is there something that you would want us to have as a takeaway from the Endos projects, from the work that you have done? Your one final message of motivation to wrap up the talk.
Uh, I mean, my final message is one of extreme thanks, I think. Those of us who have worked on the narrative side of this, and the three of us that were in Austria a few years ago, none of us, fortunately for us, none of us have endometriosis, and we are incredibly grateful to those that those who do and who have taken their time and their effort and their energy to contribute to this project through the platform, through participation at that conference, through artistic contributions. None of these things are easy. It all involves time and effort, and but we would not have produced any of the work without all of your contributions. So thank you.
That is a lovely sentiment. And thank you for coming up with this project, for fighting for it to take place, and for all the hard work that you have put in. It is really a big project. It was a big endeavor. And I think we are all richer for it existing. So thank you so much also for taking the time now to present this to us and to chat with us. Thank you so much.